So we are doing chest X-ray views, and so lateral decubitus view is done for the chest, and positioning of the lateral decubitus is, this is a special view for demonstration of fluid or एयर इन द प्लूरल कैविटी को चेक करने के लिए किया जाता है. लाइज ऑन द अफेक्टेड साइड ऑफ to demonstrate fluid in pleural cavity, on the non-affected side to demonstrate the air in the pleural cavity. So cassette is placed vertically behind or in front of him and centering to the middle of the cassette using a horizontal beam. And this is the lordotic view, lateral decubitus view of the chest and sternum. So sternum is a flat bone in the center of the chest, anchoring the anterior ends of ribs on the two sides. An anterior oblique view of the sternum. So patient is standing or sitting facing the bucky, and patient is then rotated 20 to 30 degree to the either side and centering, so central ray perpendicular to the film and towards a 7.5 meter lateral to T5 vertebra or 2 inches below sternal notch on the side nearest to the X-ray tube. And patient is allowed to breathe gently during on exposure to cause blurring of the lungs for better demonstration of the sternum. जो सेंटरिंग होगी वो टुवर्ड्स पॉइंट होगी 7.5 meter lateral to T5 vertebra and 2 inches below sternal notch on the side of near X-ray tube. And patient allow करा जाता है to breathe gently during the exposure to cause blurring of the lungs for better demonstration of the sternum. And image criteria which should be included, and that sternum should be seen totally clean for the mediastinum and soft tissue shadow. And lateral sternum view, the patient stands erect with either shoulder against vertical bucky and feet separated to ensure stability. Hands are clasped, जो पेशेंट खड़ा होगा हैंड्स clasped होंगे behind the back and shoulder pulled well back. A long 60 inches focus film distance is used and centering, so horizontal ray towards a point 2.5 centimeter below the sternal angle, and sternal should be in profile as linear flat bone. And here we can see this is the sternum bone, and this is the sternum lateral view. So heart and aorta. Besides the chest PA X-ray and lateral chest X-ray oblique views are used for studying the heart, and right anterior oblique view for the heart and aorta. So positioning, from the position patient is rotated, and the right posterior anterior side of patient thorax is kept in contact with the cassette, and trunk is rotated to bring the coronal plane at 75 degree to the film and centering to the vertebra T6. So left anterior oblique, from posterior anterior position patient is rotated such that left side of thorax is in contact with the cassette and coronal plane at 75 degree to the film, and centering should be T6 vertebra. And radiography of the abdomen. So abdomen is the body cavity below the diaphragm which separates is the from the thoracic cavity. The lower part of the abdominal cavity is called pelvis. And structure of abdomen. So abdominal cavity is lined by the peritoneum, limiting the peritoneal cavity which contains the liver and the gallbladder, spleen, stomach and small intestines, kidneys and ureters, pancreas, large bowel, except transverse colon lies behind the posterior peritoneum is the retroperitoneal space, and rectum, urinary bladder, parts of the reproductive system are located in the pelvic cavity. The abdomen is arbitrarily divided by 4 imaginary planes into 9 regions as follows. So these are the 9 regions of the abdomen, and this is how it is divided. This is the region 1, which is epigastric region, and this is the region 2, umbilical region. Region 3 is the hypogastric region, and this is the region 4th, hypochondrium region. Region 5 is the left hypochondrium region. Region 6 is the right lumbar region, and region 8 is the right iliac fossa, and region 7 is the left lumbar region, and region 9 left lumbar. This is the, and region 8 is the right iliac fossa, and region 9 is the left iliac fossa. Okay. So radiographic evaluation of abdominal contents begin with plain film examination. When abdominal X-ray is pre-planned, intestinal tract must be evacuated of gas and fecal matter. So रेडियोग्राफिक एवेल्यूशन एब्डोमिनल कंटेंट्स को देखने के लिए किया जाता है. प्लेन फिल्म एग्जामिनेशन होता है व्हेन एब्डोमिनल एक्सरे प्लेन प्री प्लान्ड होता है. देन इंटेस्टाइनल ट्रैक्ट मस्ट बी इवैक्यूएटेड होना चाहिए गैस से या फीकल मैटर से, for which patient is asked to take laxative and castor oil, and as well as a gas absorbent charcoal tablets the night before the examination, and patients should come fasting the next day in the morning, and cleansing enema may be required in chronically constipated patients. However, this preliminary preparation is omitted in cases of acute abdomen intestinal obstruction or perforation in infants, small children, and routine X-ray films are taken either in supine or prone position, including whole of the abdomen from the level of the diaphragm to the pubic symphysis, and patient asked to hold breath during exposure. Sometimes a compression band may be used for the immobilization of the patient, like children's. And X-rays which are taken, so X-ray abdomen, AP, erect and supine, lateral cross table, lateral view, and invertogram in the child's. So abdomen AP view, patient lies supine or stands erect facing away from the cassette, and mid-sagittal plane is made to fall perpendicular to middle of the cassette, and which is centered at the level of iliac crest or just above the umbilicus. In erect X-rays, centering is done a little higher so as to include both domes of the diaphragm. Exposure is delayed for few minutes if the free air is suspected in the peritoneal cavity to allow gas to rise, and exposure is made with use of grid in either case, and central ray is perpendicularly directed to the center of the film, and the radiation protection of the gonads and gonad shield is applied to male patients and also is to the female patient if pelvis does not need to be included. And this is the abdomen AP supine view and abdomen lateral view. So patient is turned sideways with mid sagittal plane parallel to the table, and made is lies still with hips and knees flexed and elbow and arm flexed above the head, and the cassette is centered just above the level of iliac crest, and X-ray beam is kept perpendicular centering to the middle of the film. So cassette centered होनी चाहिए at the level of iliac crest and X-ray beam kept perpendicular centering to the middle of the film and cross stable lateral view of the abdomen. So this view is taken in cases of very ill patients who cannot sit or even lie on their sides to detect air fluid level or for air under the diaphragm. So patient lies supine with arms raised above the head and a cassette with vertical grid is supported on one side patient and placed such to include the thorax and mid-sternal level, and X-ray is taken with a horizontal beam and lateral decubitus view for the abdomen. This projection is used when patient cannot stand erect and patient is made to lie on his left side with the cassette vertical against the patient abdomen. Upper part of the cassette should be at the level of the lower ribs so that film includes the lower parts of the lung field, and the film is taken by horizontal beam directed posteriorly and centered to the center of the cassette. So this is here lateral decubitus of the abdomen view and invertogram. This is inverted abdominal radiography taken in neonates of the suspected anal aesthesia and to look for the upper level of the gas which corresponds to the level of obstruction in the large bowel and rectum. So this X-ray is taken not less than 18 hours after the birth, which is time to taken by the air to reaches the rectum is normal. Newborns and neonate is held upside down with the feet for about 5 to 10 minutes, and AP and lateral radiograph is taken with the vertical bucky, and alternatively a front translateral view can be taken with a horizontal beam. And radiographs in acute abdomen, so series of X-ray in acute abdomen needed are abdomen supine view, abdomen erect or left lateral decubitus, and chest PA including abdomen. So X-rays, apart from detecting radiopaque stones, calcifications and foreign bodies, will also demonstrate to the distribution of air and fluid levels in GIT, as well as detect the free peritoneal gas for erect film. 5 to 10 minutes times has to be given in the particular patient before exposure. And biliary tract, so for the biliary tract we used to do left anterior oblique prone view and positioning prone with right and hand resting and head and left arm lying along the side and behind the trunk. Right side of the patient is rotated to bring coronal plane at 20 degree to film, and right posterior oblique view, so positioning with patient lying supine and left side is raised rotating median sagittal plane through the 20 degree. Both shoulder and elbows are flexed to place both hands above the patient's head. So centering midway between midline and raised side of the abdominal wall 2.5 centimeter ऊपर होनी चाहिए than the lower costal margin and to the center of cassette. And KUB, kidney ureter bladder, the most common abdominal radiograph for the KUB is reason for the detection of the radiopaque calculi and preparation of the patient. A bowel preparation to clear the bowel gas, fecal matter is necessary prior to the radiograph, and removal of all artifacts for the region of the interest is also mandatory. So abdomen AP supine view, and patient is supine with hands over the chest and mid-sagittal plane in the middle at right angles on the table. Cassette is placed in the bucket tray so that upper level is at the jiffy sternum and lower below the pubic symphysis. Center of the cassette should be at the lower costal margin and perpendicular X-ray beam is directed towards the center of the cassette and exposure made in full inspiration. एक्सपोजर फुल इंस्पिरेशन में होगा एंड lateral view position lying on the side under examination with hips and knees flexed. Median sagittal plane is parallel to the film and vertebral column is along with the midline of the table and cassette with bucket tray is centered to L1 to L2 vertebra and about 5 centimeter above the lower costal margin to study the renal areas and centering in the middle to the film is suspended respiration and posterior oblique radiograph and patient is raised from a supine position until the coronal plane is 20 to 30 degree from the table and for the kidneys a smaller cassette is placed in transversely to the bucket table and X-ray beam is centered between umbilicus and jiffy sternum and whenever the ureters are to be included in a larger 15 by 12 size film is used and center is done at lower costal margin. The central ray is directed to be center of the cassette and यूरिनरी ब्लैडर के लिए एंटीरियर पोस्टीरियर करते हैं विद द 15 डिग्री caudal angulation with the patient supine and mid sagittal plane at right angles to the middle of the table and the cassette is placed with the lower edge 5 centimeter below the pubic symphysis and central beam is centered to the center of the cassette with 15 degree caudal angulation. Grid यूज की जाती है and posterior oblique positioning patient is rotated through 35 degrees with the patient midway between the pubic symphysis and anterior superior iliac spine on the raised side lying on the midline of the table and cassette placed की जाती है with its upper border at the level of anterior superior iliac spine and centering will be at the 2.5 centimeter above pubic symphysis and radiography in special situation. So emergency radiography, pediatric radiography and mammography, these are done in the special situation. So we will continue from the emergency radiography in the next video. So till then, like, share and subscribe. Keep studying and like and subscribe.